Hello, my name is Dr. Sadaf and today we will be performing diabetic foot examination on Dr. Kamran. First, I'll obviously greet the patient and ask for the consent, and then I'd ask for the adequate exposure for the examination. Hello, Dr. Kamran.
Hello.
How are you doing?
I'm good, thank you.
I'll be performing the diabetic foot examination on your lower limbs today. For that, thank you for being adequately exposed, and I'll be performing certain procedures on your limbs. Would that be okay with you?
Yep.
Okay, thank you very much. So starting with the examination, we will first go for the inspection. As the patient is adequately exposed, we specifically need to look at the limbs below the knees. So on inspection, we will look for we will look at both limbs bilaterally, and we will look for any discharge, any redness, any swelling, any sinuses, scar marks, specifically because diabetic patients have impaired sensations in their extremities, so they could have wounds or injuries which they're not aware of. So any scar marks. Also, we would look for any obvious pigmentations, any loss of hair or any abnormal hair distribution because of the compromised vascular supply, and also something to be noteworthy is any ulcers, and there are specific areas for ulcers. So we will look at both the limbs, but specifically at the feet, at the pressure areas where there could be sores or ulcers. So that's the bunion area, and specifically the heels. So Dr. Kamran, if I could please lift your foot, look at the heel area on the right foot, and look at the heel area on the left foot now for any ulcers, and also for the bunion area on the left side as well. Another area to look at for any fungal infection or ulcers is the interdigital webs. So open all the web spaces and look for any interdigital ulcers or fungal infections. After looking at ulcers and the pigmentations, hair distributions, and also look for some skin shininess, that is also because of the vascular compromise. So this is our inspection. We've looked bilaterally. One last area to be looked at after you've seen the dorsal aspect is the back of the limbs. If I could please raise and look for any ulcers or any scar marks, and all the things that we discussed from the front, you need to look at from the back as well. And after that, moving on to the gait. So I would ask the patient to stand up from the couch and walk a few steps, and high steppage gait is normally something to be aware of in diabetic motor neuropathy. After the inspection, I would move on to palpation. So I'll be gently touching your both limbs, and if it causes any pain, please do let me know. So for the palpation, you will first of all look at the temperature. For temperature, you need to compare both the limbs and use one of your hands so that your temperature is the same for the patient. So comparing bilaterally, starting from downwards going upwards. So from the foot first, because normally due to vascular compromise, diabetic patients have cold extremities. So you could either go in a zigzag manner or in an ascending manner, comparing the same areas. And it's good from the back of the hand. And lastly, for temperature, you also need to look at the calf temperature. So over here, shouldn't be warm because it would indicate some infection or something just going on. After the temperature, we would go for the tenderness. I would be gently pressing on your limbs. If that causes any pain or discomfort, please do let me know, okay? So starting from the feet and looking at the patient's face, specifically the feet, and then the calves are something that you need to look for, tenderness. And the calves again. After the temperature and tenderness, we will look at two things which are related to the vascular supply of the foot, which is the capillary refill. So we will press on the nail for about 5 seconds, and then remove and see if the nail reperfuses in less than 2 seconds, which is normal. If there's a delayed refill, that means there's a vascular compromise. And we will do the same on the other limb. So the capillary refill is normal on both sides. The last thing to see for vascular compromise is the pulses. So there are two pulses that we specifically see, the dorsalis pedis and the posterior tibial. The dorsalis pedis is the artery running between the first and the second flexor tendons of the foot. So palpate for it here and bilaterally. So the pulses are palpable and bounding normally in both feet. The other pulse is the dorsalis pedis, which runs behind and can be felt behind the medial malleolus. So bilaterally palpating those as well. So the pulses are palpable and normal. So there is no vascular compromise in this patient. So this finishes our general examination. Moving on to the neurological examination in a diabetic foot. I'd be touching different objects on your limbs. The first of which will be a cotton wisp. So we are, first of all, we're going to test the touch sensation, and this will be fine touch sensation for the patient. For this we will be using a cotton wisp on the limbs, and for the soles, because it has hard skin, we usually use a monofilament. So make the patient aware of what it feels like. So this is a wisp of cotton, and this is what it looks like, and this is what it feels like. Okay, I'll be touching this on various places on your lower limbs, and when you feel it, please say a yes for me. During this procedure, I'd like you to close your eyes and say a yes for me whenever you feel it. Okay, so we will be touching this bilaterally and comparing the sensations and going in a zigzag manner. So, and test all the dermatomes of the lower limbs. So please say a yes when you feel the wisp of cotton. Usually diabetic patients have a glove and stocking pattern, loss of sensations in the lower limbs, so they might not feel.
Yes. 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 Yes.
Thank you very much. So normally, as long as you don't get a sensation or a yes from the patient, you keep on going up to check the level of neuropathy. So my patient has peripheral neuropathy till mid-calf, and he can feel the sensations from above it. So you discard this in a clinical waste bin. And the second sensation that we will be testing the patient on, and I did say that on the sole of the feet you need to check the fine sensation as well of touch, but that would be with a monofilament. Now we will check the sensation of proprioception in the patient, for which I will explain to the patient what I'll be doing first. So Dr. Kamran, I'll be moving your thumb and then your ankle up and down. So the thumb I will move like this. This will be up and this will be down. Okay, I would like you to close your eyes and let me know if you feel it up or down. Okay, similarly I might do it on your ankle as well. So for the ankle, this would be up and this would be down. Okay, and let me know if how you feel it up and down. Okay, if you could please close your eyes now. Now
this is down.
Okay, and what do you feel now?
Up.
Okay, and now?
Down.
Okay, and you need to check bilaterally. So where do you feel your thumb now?
Down.
Okay, and now?
Up.
And now?
Down.
Okay, and where do you feel your foot now?
Up.
Okay, and now?
Down.
And now?
Up. Down.
So the proprioception was impaired in the toes, but it is normal in the ankles. Moving on from proprioception, we will be checking the vibration sensation in the patient. So for the vibration sensation, we use the tuning fork with the longer limbs, and it is the 1281 frequency that we use. So we will, Dr. Cameron, so this is a tuning fork, and this is what it looks like, and this is what it feels like. Okay, I'll be touching this on various places on your lower limbs, and you need to tell me if you feel it vibrating. Okay, thank you very much. Okay, do you feel anything?
Yes.
Okay.
Yes. Yes. Yes.
Thank you very much. So the 4 places that we check on the lower limbs are the medial side of the big toe, the medial malleoli, the shins, and the patellar bone. So my patient had no sensations up till the shin, and from above he could feel the vibration sensations, and they were intact. Moving on, we need to check the pain sensation. So this is a neuropin. This is the blunt side of it, and if you remove the cap, there'll be a sharp pin inside. So this is a neuropin, and I'll be touching with the blunt side first on various places on your limbs, and this is for coarse touch. So wherever you feel, say yes for me, okay? And after that, I'll be checking for pain sensation, okay? And I will let you know before I start, but if you feel a pain prick from a pin, you will let me know with a yes, okay? Thank you very much. So starting with the core sensation, say yes for me with your eyes closed if you feel anything. So doing it bilaterally.
Yes.
Okay.
Yes. 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 Yes.
Okay, thank you very much. So coarse touch was positive above the mid-chin. So now checking for pain sensation. This is the neuropin. You remove the cap. This is only to be used on one patient only. So you remove the cap. Now I will be testing the pain sensation, Dr. Cameron, and with this sharp pin. So please let me know when you feel the pain, okay? Touch it gently, not pricking the patient too much. And looking for the patient's expressions on the face.
Yes.
I'm sorry.
Yes. Yes. Yes.
Okay, so the pain sensation is intact above mid-calf, and it is altered below the calf. This, remember, needs to be thrown in the sharps bin and is to be only used in one patient at one time. Okay, the last thing that is to be done is the reflexes. So we normally check the ankle and the knee jerk in the patients. For that, you need to position the patient in a way. So if I could please flex your knee, and so you need to extend or plantar flex the ankle. Feel the Achilles tendon. So the ankle reflex is intact in the patient, so you check bilaterally. And after that, if the ankle reflex is not intact, you ask the patient to, if you could please slide your legs down by the end of the couch for the knee jerk. You ask the patient to cross the limbs over one above the other, like that, so that the patient is relaxed. You feel for the quadriceps tendon. And you see a knee jerk reflex. So you do Thank you. If you could cross your left leg up bilaterally. So you see the knee reflexes are intact in the patient. Thank you very much. This concludes our examination for diabetic foot. I hope you enjoyed and benefited. Thank you.